Well, I'm 61 years old, lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the number one community as being widespread.
Austin Public Health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods that cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, was really important.
Circle is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration.
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
We're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at night in Madison, means a lot.
The mission of Circle is to address the health inequities that our communities of color are facing on a daily basis.
Okay. Good evening, and thank you for joining us for our conversation tonight on COVID-19 treatment options. Before we get started, I first want to make some quick introductions and acknowledgements. I'm your host, Abigail Silva. I'm an assistant professor at the Loyola University Chicago. I'm an epidemiologist and also a health equities researcher. And tonight, who's joining me is Dr. Jackie Korpix. She's a medical director of the COVID response at the Cook County Department of Public Health. She will be speaking with you about the treatment options tonight. Dr. Tamaja Jordan, she's a family medicine physician at McNeil Hospital, part of Loyola Medicine and Trinity. And she will join us along with Dr. Korpix in the panel during the Q&A portion of the evening. We're grateful to have her here as well. And then, of course, Ms. Gwen Smith-Haney will join us tonight as well as a panelist. She's the Circle Community Liaison at Loyola University Chicago. She is our ear to the community, and she also makes sure that we stay true to our mission of serving the communities in which we work. Thank you for that. So I also want to acknowledge the Village Free Press for hosting us tonight on their platform and helping us advertise this event. They've been our allies during this pandemic. I also want to say thank you to the Cook County Department of Public Health for the various resources it has provided to Circle in our communities to help meet the need, including educational material, PPE, vaccination clinics, and of course, sharing one of their experts with us tonight. And of course, thank you to Loyola Medicine and Loyola University for lending us support throughout our COVID work, including, again, tapping into one of our very own experts in terms of Dr. Jordan tonight. So a quick agenda tonight. I would like to spend the first 10 minutes or so just giving you a really quick update in terms of where we are in terms of the pandemic, in terms of COVID cases. I also want to review with you the various ways that we can keep our communities and ourselves safe. Dr. Korpix will then spend about 15 minutes reviewing all the treatment options for COVID-19. And we will spend the last 30 minutes of the hour posing questions to our panelists, including the ones that we received from our community. So in suburban Cook County, 500,000 cases of COVID-19 have been diagnosed, with the highest peak occurring in January of this year. And while the cases have dramatically decreased since then, we are experiencing another increase over this past month. So as many of us know, the pandemic has hit the Black and Hispanic communities particularly hard. To the left here, you can see the rate of cases per capita by race. The Black and Hispanic rates are the highest of these four groups presented here. The figure on the right shows the case rate across the various municipalities across suburban Cook County. Those in the darker shades of blue are the ones that have been impacted the most in terms of cases. You can see here that not all areas have been impacted equally. The hardest hit communities are in villages in western and southern suburban Cook County. Unfortunately, due to the recent rise of the number of positive cases of COVID in suburban Cook County, we are now in the medium level of community transmission. So the Centers for Disease Control and Prevention's COVID-19 community levels framework defines medium transmission as higher than 200 cases in the last 7 days per 100,000 residents. So as of today, suburban Cook County is reporting a rate of 244 cases per 100,000 among our residents. So what does that mean for us, that our community has a medium level of community transmission? Well, the good news is that we do have tools or layers of protection against COVID-19. In fact, the Cook County Department of Public Health issued a reminder of what we should be doing right now to keep our communities and ourselves safe. So one, wear a mask indoors to protect those at highest risk for severe illness from COVID infection, including adults over the age of 50, those with underlying medical conditions, and the immunocompromised population. Two, socialize outdoors to the extent possible and avoid poorly ventilated indoor settings. Three, get tested before attending a family or public event, and home testing is ideal for this kind of purpose. Four, contact your doctor right away for treatment for COVID if you're diagnosed. And again, you'll learn a little bit more about this over the next 15 minutes. And then get any COVID vaccine or boosters that you're eligible for. If you haven't been vaccinated, get vaccinated. If you're eligible for a booster, please get boosted. So if you're wondering where you can get tested, please don't forget that every home in the United States is eligible to order two sets of 4 tests that you could do at home. If you already ordered your first set, you're eligible to order a second set today. And we listed here the website where you could do that. Also, some health insurance programs like Blue Cross Blue Shield and Medicaid also cover the cost of the home test kits. The Illinois Department of Public Health also posts on their website where you can go and get free shield or saliva testing. And we here at Circle are still offering free testing 3 days a week by appointment. You can also visit our website for more locations that offer free COVID testing in the community. And of course, the COVID vaccine is an important tool in stopping the pandemic. The vaccine is a safe and reliable way to build protection against the virus. There are still plenty of places to receive it. The Cook County Department of Public Health has a website that includes a community calendar that shows when the next event in your neighborhood is occurring with regard to vaccinations. Please also check the Circle website where we list the vaccination sites in the proviso area. Also, if you're homebound, the Cook County Department of Public Health also has a program where they bring the vaccination to your home. So you could call them or sign up via their website. And please do contact us if you need any further assistance or information. We're here to serve you. Now, without further ado, I'd like to hand things over to Dr. Korpix so that we can learn a little more about the latest in COVID-19 treatment.
Thank you, Dr. Silva, and thank you for having me today. Just one update in relation to Dr. Silva's presentation. Our in-home vaccination program is now available to all individuals who are 5 and older. So we're pretty excited about that. And then we usually have gift cards for individuals who take advantage of that program. It's while supplies last. So definitely encourage people to take advantage of that program. Now I'll just go into an overview of treatments that are now available in the outpatient setting. You don't, and let me just advance my slide. Okay, so currently we have treatments in the outpatient setting available for individuals who are 12 years and older. We know that these treatments are effective and they reduce hospitalizations and they save lives. Treatment must be started as soon as possible when you test positive for COVID-19, usually within 5 to 10 days of symptoms. We know that unfortunately these treatments are being underutilized. We realize that's both an issue of, lack of public knowledge, but also initially we were struggling with educating providers also about these medications, their use, and their availability in our county. There's also been some confusion about where treatment is available, so we'll cover that. And then, despite what Dr. Silva mentioned in regards to our Black and Brown communities being hit harder by COVID-19, we've actually seen already a racial and ethnic disparity in those who are receiving COVID-19 treatment. And definitely not something that we want to be seeing and want to work in reducing that disparity. The same disparity we've also seen in vaccination rates. And so treatment and vaccination, are one of our two of our strongest tools that we have in this pandemic. So hopefully we can work together to, improve access to everyone in our community. And this is just a graph showing the already documented disparity in individuals who are getting treatment and who aren't. And so seeing less treatment use in both our non-Hispanic Black population and Hispanic Latinx population. So now I'll go over just an overview of the current options that we have available. On the left-hand side, you'll see monoclonal antibodies. So we have monoclonal antibody infusion therapy. This is for treating COVID-19 to prevent hospitalization. So you receive this injection or infusion in the outpatient setting. So you usually go to a hospital site or another clinic site that offers this treatment. And we'll talk about where to go to get that in just a moment. The middle column is what we're probably the most excited about, which are oral antivirals, especially the drug Paxlovid, which we've found to be extremely effective in treatment of COVID-19. And we have it, pretty available for people to use and pretty minimal side effects. And then you just have to pick it up from a pharmacy or have a pharmacy deliver it to you, and you just take it as a pill, like similar to other medications. So that one, we really want to get out there because it's easy to use and it's extremely effective. And then the one on the right is pre-exposure prophylaxis. So this is not to treat COVID once you already have it. Evusheld is a treatment that you take to prevent illness. And this is only for people who have moderate to severe immunocompromise. It's not to be used as a replacement for vaccination, but rather in individuals who've gotten their vaccination, but we don't think the vaccination was as effective for them because of their immunocompromise. That treatment also, unfortunately, we're finding is not being as widely used as we would like it to be. So treatment should be considered or offered to anyone at increased risk for a bad outcome from COVID-19. So that includes anyone who's been vaccinated, even though we know, of course, vaccination, especially if you're boosted, reduces your risk of hospitalization and death. And so one thing that we've seen confusion with both in the public sphere as well as on the provider side is that a lot of people are considered to be at increased risk for severe COVID and therefore should seek out treatment if they test positive for COVID. So, huge group of people includes anyone who's 65 and older, anyone who's overweight or obese, anyone who's smoked or previously smoked, anyone who's pregnant, and then anyone with any of the conditions listed on the right-hand side. Some of them, which are pretty common, like diabetes, mental health conditions, chronic kidney disease. So lots and lots of people qualify, but don't realize that this is something that they can and should take advantage of in order to ensure that they're keeping themselves or their loved ones out of the hospital if they, contract COVID-19. So accessing treatment has been a little bit tricky and confusing for the public. Fortunately, now there are test to treat locations to fill both to get your test and then also to fill your prescription. So now there's hundreds of pharmacy-based test to treat locations nationwide. This is the test to treat locator. It's the same link used nationally. And this is what you would use to find out either where can I go test to treat? I want to get a test and potentially get my prescription for Paxlovid filled at the same location. Or maybe I have a regular doctor that I see, but my doctor doesn't know where Paxlovid is and where they can prescribe it to. So you just educate your doctor and tell them they just have to go on the site and you pull up the pharmacy closest to you and they can send their prescription there. Hopefully you won't have to educate your doctor and that your doctor also knows about this link and can find the place where they can send you for your prescription. Ideally for Paxlovid, because it's an oral medication, just some pills that you have to take. But some people, due to underlying diseases like chronic kidney disease, do have to do the infusion instead. So you go to an outpatient infusion center, and then we just have your doctor write a prescription or referral to one of those locations, and there's a lot of those locations in Cook County now. So these are just the steps listed out. There's also a phone number for the test to treat locator. And then, like I said, so key messages, there's medications that we can give to people to save lives and keep them out of the hospital. We want people to be using them more, especially people who we, know are very vulnerable. There's many people who qualify for these, who are eligible for these medications, and they should take them. Everyone 65 and older, anyone who is a smoker, anyone overweight, obese, or any of those conditions I mentioned, diabetes, chronic kidney disease, definitely talk to your doctor or show up at one of these locations to get evaluated for treatment. Treatment works best when given early, so you can't wait to access that treatment. So Paxlovid, for example, you have to take within 5 days of when your symptoms started. A physician or provider is needed to write a prescription. So that can be tricky because we know not everyone has a primary care doctor or a doctor they can easily get a hold of very quickly. And so while that is an option and possibly preferred by some individuals, others will opt to use a test to treat locator instead, just to ensure that they're getting that test quickly and then they're getting their prescription quickly. These are some resources we have available on our website. I encourage you to look at our treatment page. We also have a flyer that we, encourage you to distribute in your community. And I will stop there.
I think I'm waiting for my guests to arrive. Okay, great. Dr. Jordan's joined us. Hopefully Dr. Corpix will pop in, and then Miss Gwen. Thank you, Jackie, for that. I have so many questions to get us started, but of course we invite all our viewers to ask us and post any questions that they might have. So thank you for that. I do have a question to get us started, and then maybe I'll hand some over to you, Ms. Gwen, if you have some questions for us. I wanted to ask, and maybe this is something you hear, Dr. Corpix, why would someone get vaccinated if there's treatment available? What do you tell to those patients?
Yeah, so when we're talking about the tools we have in our tool belt to protect ourselves against COVID, like you mentioned, vaccine, treatment, open spaces, washing your hands, testing, vaccination is by far the best tool that we have to prevent people from going to the hospital or from dying from COVID. Just by far above and beyond, the best tool that we have.
Okay, great, thank you. And then another follow-up question, as you were saying that a lot of providers also weren't aware of some of these medications or where to get them. What is the Cook County Department of Public Health doing to educate or help educate our providers?
That's a great question. So we've been working with our providers, connecting with them directly and providing educational webinars about these medications, offering our infectious disease specialists to do any consultation, answer any questions for providers, educate them about, where the medications are currently and how they can sign up to even have them on site at their own clinics if possible.
Okay, great. Thank you for that. And Dr. Jordan, what are you seeing right now in your clinic? Did how much information did you learn, if anything, from our talk with Dr. Corpix this evening?
Well, actually, I'm happy to say that we've had what appears to be much less patient chief complaints, where they're coming in complaining of symptoms that are consistent with COVID, which has been great to see. There's been a lot of different advertisements in our lobby. We get emails all the time, both from Loyola, from the General Medical Education Department, encouraging us to learn more. I'm one of the faculty at our family medicine residency program, and I enjoy what I do because then it allows me to stay in the right place to get updates, which I enjoy.
Okay, that's great. Dr. Smith Haney, I mean, Miss Haney, do you have any questions?
I do. I have quite a few questions. First thing is, if you don't have a physician and say they come to us to Circle and get tested and they test positive, okay, so how would they get treatment? Because they're not doing tests to treatment. So if they don't have a physician, then what would they do?
So you can still use the test to treat locator to find a site. So that's still an option. You would just need some kind of proof of your test. That being said, providers are encouraged to be pretty lenient. So even if it's an at-home test, which we know, like going to work, for example, a lot of employers aren't taking in-home test as proof. In this case, we want people to get treatment. So we're encouraging providers, even if your patient says that they got treated or they took an at-home test and it was positive, believe them and offer them the treatment.
Okay. Next question for you, Dr. Jackie. How much publicity is going out to the public in regards to this test, to these different COVID treatment? Because I haven't really seen much, and I haven't been asked a lot of questions about that there's other treatments out there in regards to COVID.
Yeah, that's a great question. We've been working most closely with our community-based organizations to make sure that we're getting the messaging out. Also, recently, I did see a commercial that's been playing nationally, informing people about Paxlovid, which is one of the medications that I was talking about. But we're really, really relying on working with our community-based organizations, providing these educational fact sheets, doing webinars like this to get the information out. Because you're right that it has not been widespread knowledge like it needs to be.
Thank you for that. I think also if we could put it through our banner, we've also put a fair amount of information on COVID-19 treatment now on our website. And, we've also looked at Cook County, for some of that information and vetted some of that to make it easier and more digestible for the general audience, because I didn't know about it much as well. Dr. Jordan, are folks asking you at your clinic any questions around treatment, or what are some of the questions or concerns they might have?
Honestly, of late in the last few months, I've not had anyone ask me personally for any info about treatment. I'm still at a point where I'm trying to get patients to go and get vaccinated. So I'm still having a lot of those conversations with patients, even patients in the healthcare arena who are just very hesitant to get vaccinated.
Okay, thank you for that. That's true, and that just reminds us about the role that vaccination does play and its importance. I did have a question about the requirements for getting, access to treatment. You pointed out, age, right, and being overweight and obese. How about social factors? For example, if somebody is a caretaker of somebody who is immunocompromised, or the sole caretaker of a child, or what have you, does some of those social factors play a potential role? And
Yes,
would that be enough to get access to some of the treatment?
yeah, in that case, so every prescription, every medication, you do need a prescription from a doctor. So an individual would evaluate the person in that circumstance. And so maybe they would find out that they didn't maybe have one of the things that I had on my slide, but together may realize that they would still benefit from medication, and that provider may go on to prescribe it.
Okay, thank you for
And
that.
I don't know if Dr. Jordan, you would add anything to that.
I have a question that's connected to that, Dr. Jackie. Ever since COVID is kind of ending up here, it's been very difficult to get doctor's appointments or speak to the doctors or speak to a nurse. So what do you do if you can't contact your doctor? If you can't reach your doctor, what do you do?
Yeah, again, great question. We know there's a lot of issues with our healthcare system. And so I would say, first off, go to one of the go to the test to treat sites. You'll find the places that are offering treatment, are knowledgeable about it, and hopefully you'll be able to get an appointment there. From the health department's side, we've been working with providers to make sure that they're getting patients in time to be treated. So trying to work with providers to establish perhaps a separate hotline if people are calling about treatment, perhaps doing telehealth visits. And then at Cook County Health, we're trying to work at our hospital system to just establish a general hotline number that patients could call or non-patients to get people in quickly. So we know that's an issue, and so we've been working with providers on that.
Yeah, no, we definitely have been
Thank you.
using our immediate care centers a bit more in the last couple of years. Through the Loyola system, our patients have options. Now, whether or not they take walk-ins from other clinic sites, I would imagine that they do. But it's been great because those sites are manned by nurse practitioners and physicians who can not only test, but they would have the ability to offer treatment, and the wait wouldn't be as long if a patient wanted to establish care at McNeil or at one of our facilities. So that's been great. Early in the pandemic, we did have a sort of hotline for our clinic that our residents in training were staffing. Even some of the medical students at Loyola were staffing to just help, you know, give our community the chance to call and ask questions. And I think now that everyone's kind of back to work and things have progressed, I don't think those lines are still manned quite as fully as they used to be.
And then I'll also add that this is an ideal situation, but we recognize that in our current healthcare system, sometimes when people are not able to be seen quickly by a primary care provider or at an intermediate care, that people do go to emergency rooms for care that maybe isn't, a true emergency. But we are working with people, with emergency physicians and ERs to try and make sure that all ER physicians are also knowledgeable and able to write prescriptions for these medications.
Thank you. I'd love to ask you a question, and either one of you can answer it, Dr. Jordan or Dr. Corpix. What are the virals, the antivirals? Is that like a 2-week medication? Is just 2 pills that you take once? What is that experience like? And versus the antibody infusion that you need to take, and exactly when do you get one versus the other? Can you tell us a little bit more about that?
I didn't know if you wanted to take that one first, Dr. Jackie, but I've had some experience. Really, I'm a prenatal care provider at McNeil, and I had one patient who was she taught at a Montessori school and got COVID twice in like a 2 or 3 month span, and I was seeing patients at a federally qualified health center that's pretty close to McNeil, and we went. I literally just gotten an email that day from our leadership saying, use this Locator website, if you want to treat. And so I sent her the pills. And funny, I thought it was just going to be like a one-time dosing. And then I looked at the prescription as I was typing it in. It's just like Tamiflu. So it's one, but it's a pack of pills because it's 2 medicines in Paxlovid. So it's a dose in the morning, a dose in the afternoon, and it's for 5 days.
Okay.
And so it's usually patients who are patients who are high risk, but I think probably not people who are really, really immunocompromised. Maybe Dr. Jackie can speak on it a little bit more.
Yeah, no, that's great. For Paxlovid, just twice daily for 5 days. You may have seen in the media they're also looking into if some people may need 10 days, but nothing's been decided officially on that. For the injections or infusions, you would have to come in, like I said, to receive those. And so for some of the ones we have, so the one of them being bebtelovimab is an IV infusion. It's actually just a single IV infusion, which everyone is pretty excited about. And it just takes like 30 seconds. And then they kind of watch you, make sure you don't have any reaction to it, and then you're on your way, and that's it. For Evusheld, so the pre-exposure prophylaxis, that's also just a single IV infusion, an IM injection, and then that lasts actually for 6 months, we think. So that, you're getting long lasting protection and not having to spend, a really long amount of time in a hospital or an infusion center getting that.
Okay.
And that was a new medication that I just learned about tonight on the call. So, one thing that I've realized over the last couple years is that a lot of the recommendations are changing. The monoclonal antibodies that were recommended for infusion at the beginning of the pandemic, a lot have been pulled away as not being authorized for emergency use. So I think we've been through at least 2 or 3 monoclonal antibodies, and now with BEB, as they call it, haven't used it yet. But I think it's one thing to keep us, I think, on our toes as providers to make sure that we're kind of keeping in touch with the Cook County Department of Public Health and the Illinois Department of Public Health, so we know how the research and things are updating the therapies that we're using.
Yeah, and that we work closely with the Illinois Department of Public Health. And so basically, if we find that a certain drug is not effective with a current variant, that medication gets pulled. So providers don't even have to worry about potentially using a medication that's no longer effective. So every medication that we have out and that's approved that providers can give out, currently they're all paid for by the federal government. They're all considered to be effective and safe.
Thank you for that. I was curious about this. Are there side effects to some of these treatments?
Yeah, so in general, side effects are considered to be pretty minimal. We certainly may see some. So for the injection or infusion, some people may have some kind of reaction to the infusion. But that's been seen to be pretty rare. Um, for Paxlovid, again, we find that side effects are pretty rare, but we will have some people have like nausea. Same thing happens with Tamiflu. We'll have people with some upset stomach after using the medication, but usually we're finding that it's pretty well tolerated.
Okay, well, that's good news. I did have another question. Is there an age limit? Like, how young can you be to take some of
Yeah.
these treatments?
So currently for these outpatient medications, you do have to be 12 years and older, and you have to be at least 88 pounds. We did just get a medication for less than 12, but that's only for hospitalized children.
Okay, that's exciting. Speaking of children, though, are there any updates that you would like to tell us or share with us in terms of the pediatric vaccination?
Yeah, so it's been a waiting game trying to get, waiting for that approval for less than 5 years old. But we're at a point where we do think that will happen in the next few weeks or so. So we're pretty excited about that, and anxiously awaiting that to be approved and start getting that out. I will note though that even though we've had vaccine approved and widely available for 5 years and up, we're seeing really, really low rates of our 5 to 11 population getting vaccinated. So less than 50%. So we really want to work to improve that vaccination rate.
Thank you. Dr. Jordan, so what is the reasoning behind that, do you think? Since you get to see that population, what are they telling you?
I wish I could give you all the reasons. I can't speak for every patient, but some of the reasons I've heard are just leering it, just concern about what the government is giving them. I think it's always based on side effects that patients have heard about that they just don't want to experience. A lot of, like when Rihanna posted the message on Instagram or somewhere about a relative getting inflamed testicles. It's like, I think a lot of times patients, what I'm finding, they'll hear something and they haven't really read necessarily how frequent or how often that particular side effect is, if it's even truly a side effect, and they just want nothing to do with it. And so what I find is a lot of times if the kiddos aren't vaccinated, the parents aren't either. And so I, try to just take some time to understand exactly like what are your thoughts behind it? I try to use myself as an example, like I received both doses of the Pfizer vaccine. I was boosted back in September, and I'm doing okay. Like I try to ask where the concerns are, but it's I think a lot of times it's the worry too, well, why is it that we all of a sudden are learning about this or being given this vaccine through a new route of like administration, where there's these messenger RNA, and people are just very leery, like, okay, this is new for me. Why would I want to put this in my body? And it's understandable, but I try to just take the time to explain, this method of giving vaccines is not new. It's been around for a long time. We just haven't used it necessarily until now, but I try to do as much as I can to educate.
I know. And I hear that a lot too, those one-on-one conversations. And you could speak to that too, Miss Gwen. Having those one-on-one conversations seems to help a lot. It's a lot of work, but it's rewarding too if you get those, those one, because they can get somebody else too, potentially. Ms. Gwen, do you want to share anything about that?
Well, I definitely agree those one-on-one conversations are effective, especially in the brown and black community. They trust their own before they trust the physicians and the nurses. And so they will, I can give them like Dr. Jordan said, I use myself a lot. And because I've been all the way vaccinated and all the way boosted. So, I bring myself, and I'm an old lady and I'm still here. So, I use those type of things, and then I was speaking to a young lady and she has grandchildren now. I said, so you won't get vaccinated. You tell me how much you love your grandchildren, but yet you're not getting vaccinated and they're coming over every week. So if you give it to them and they get hospitalized, what? So just talking to the individuals make a real big difference.
It does. Thank you for sharing that. What can people like here at Circle could do to help promote some of the information on treatment? Dr. Corpix, Dr. Jordan, any thoughts on that? I know we have on our website, we're having a webinar today, and then we'll post this as well. But are there any other suggestions on how to get some of this information out there?
Yeah, I would say, the same thing, a way that we've approached vaccination, engaging the community, having one-on-one conversations is important, making sure that people are aware, but also working again on the provider side, making sure that doctors are asking, patients about, if they've had COVID, or making sure patients tell them if they've had COVID, because there was a change in that, right? It used to be, oh, I had COVID. There's, as long as I wasn't really sick, there was nothing I could do about it. No need to bother my doctor. No need to make an appointment or anything, worry about that. But now we're saying, hey, we want to know because we want to give you treatment. And that's, a big change in how it used to play out. So we're wanting both sides to be in contact with each other and be aware that this is a potentially life-saving treatment that people should have access to.
Thank you. That's exciting. Dr. Jordan, did you want to say something?
Oh, no, I completely agree. I think the community engagement is very key, and, circles, wonderful efforts to, kind of get the word out about treatment and about the vaccinations that are available, I think is huge. And I think just being that link for patients if they don't have a provider, I think, even having a list of places, federally qualified health centers, places where they can go, because a lot of these federally qualified health centers have extra funding as well to be able to test and give treatment on the spot. So, I mean, I think there's a lot of great resources that Circle can help our community to be more aware of, providers and patients alike.
Thank you for that.
Yeah, that's a great point. I just want to point out that, even if someone doesn't have insurance, this medication is available and not something that people have to pay for. And so you can go to a free clinic, you can go to federally qualified health center, you can come to us at Cook County Health, and you can be seen and given treatment.
I think that our materials should definitely highlight that as well, right, Miss Gwen?
That's very important, especially in the community where we are and the people that we've served during this whole thing. We've served a lot of people that don't have insurance, that don't have health care. So that's very important that they know that it's treatment out there and they don't, as Dr. Jackie was saying earlier, and they go without, oh, I just had, a little bit of COVID and they just went without treatment. It could have went worse and they can get reinfected, again. So this way, if they have the information, they'll know where to go.
But you know what, Ms. Gwen, I bet that's why I haven't heard much about about COVID, because everybody's just staying home and they don't know that there are things available. Like, yeah, so we need to get the word out.
We definitely need to get the word out. The only commercial that I've seen, and I think Dr. Jackie brought, that's Queen Latifah. She's the only one that's that commercial that I've seen. And that's what I've heard from people I've talked to. That's the only one. We need to put a whole lot more out there. We did that for the COVID, and getting vaccinated and all that. We need to do a whole lot more because people don't know that it's a treatment out there.
I think you're right. I think you're right. We're going to have to, especially with this uptick in cases that at least I know we're seeing in the community in which I live in. I did want to ask you about the prophylaxis. And could you tell us a little bit more about the treatment that you would get before you get infected? Like, what does that scenario look like? Who is that kind of patient that would be a good candidate to have that kind of a COVID treatment?
Yeah, that's a great question. So that treatment, Evusheld, is uh, it is more restricted in terms of eligibility. So you do have to be having some kind of moderate or severe immunocompromise in order to qualify for that or be eligible for that medication. But like I said, that being said, it's still not being as widely used as we would like it to be. So some examples of moderate to severe immunocompromise would be people who are getting active treatment for cancer. Maybe they had a liver transplant. They're having to take medications that suppress their immune system. They might have one of these primary immunodeficiency diseases. They might have advanced or untreated HIV. Those are all indications to go on and use this prophylaxis treatment.
Okay.
I'm wondering too if it's like poorly controlled diabetics, maybe, but I'm not sure. But this is, I think about this too. I was looking on the CDC website and it talks about even for those patients who have really bad allergies to the vaccine, it looks like they can receive it as well. Like I'm thinking already of two patients, one of my patients who's a nurse who hasn't been able to get vaccinated. Now I want to reach out to her to say, hey, we can, maybe do Evershield. Shelled.
Yeah, no, that's a great point. So while this medicine is not, you can't use it instead of a vaccine, if you're not moderately to severely immunocompromised, the other reason would be that you can't get the vaccine because of a history of a severe adverse, like, allergic reaction. So yes, that individual should definitely be considered for Evusheld.
Dr. Jackie, let me ask you this question. Would it be beneficial to, I've heard it from other people before, or I've had COVID 2 or 3 times, I can't get vaccinated. So is that someone that would take this treatment?
It's actually not true that they can't get vaccinated. And so I think there is a lot of confusion about that.
Okay.
And that, there's something called natural immunity that you get after you've had the infection, and then, we get immunity from vaccines. And we've studied that, and the data to date at least says that getting vaccinated is still a good idea, because that's going to give you the most long lasting and strongest immunity that you can get. So that's what the science is telling us right now. So even if you've had COVID once, or you had it twice, or, the recommendation is still get vaccinated.
That's a great
Thanks.
question.
That's good to know, because I've heard that quite a few times, that my doctor said I don't need to get vaccinated. So maybe they're not telling me the truth, or they're not talking to their doctor. They just assume that, okay, if I've had it 2 or 3 times. I've heard that quite a bit.
I could see confusion there, because there's definitely, in conversation with people's doctors, the doctor might say, oh, you don't need to get vaccinated now, let's wait 2 or 3 months, and then you can get your vaccination, because that's when I think your immunity from your infection will wane, and that's when that's when I want you to get vaccinated. And that message might be, misinterpreted to, oh, I don't need to get vaccinated, or I shouldn't get vaccinated. I could definitely see that being confusing. And that's actually a question that I've gotten quite a bit.
Okay, thank you. I guess I could ask you one final question, maybe Dr. Corpix, and then you, Dr. Jordan, is how is Cook County Department of Public Health, or IDPH even, planning for the pediatric vaccine coming up? Is there going to be a big campaign, or we don't know yet what's happening?
Yeah, that's a great question. So same distribution, preparing on that, and getting providers knowledgeable about, the specifics in regards to storage with that vaccination. So same thing on that end. But then in terms of, getting kids vaccinated, like I mentioned, we are still even struggling with the 5 to 11. We've been trying to work closely with schools, and I think not enough people realize that we're still offering mobile vaccination clinics for free at community sites, churches, schools, daycares, wherever you want us, we'll come.
We
So,
have you. That's true. We've used them, so that's true. We could vouch for that.
Yeah, and the in-home vaccination too, actually. So that I mentioned at the beginning, that program's available now to everyone 5 years and older. So we'll continue those programs. We have plans to continue those programs. I know school will be out soon, but certainly at summer camps and things like that, we want to have all of that easily available, so people can, so it's easy and convenient to make that decision to get vaccinated.
That's great. Thank you. And Dr. Jordan, what is McNeil doing to prepare, or you and your practice and your department, to prepare for the pediatric vaccination?
Well, we have a system of clinics that are geared towards vaccination. We have walk-in appointments available depending on the day of the week, but I'm assuming at some point we'll actually have the vaccine in our clinic, because a lot of times, it's one thing to talk about vaccine readiness and trying to, educate and get parents
Right.
really excited about the vaccines, but it's so hard too because once they want to get their kids vaccinated and we don't have then we don't have the vaccine in clinic to be able to give. So I think one of the things that has been in discussion is, will our sites all be able to safely, keep these vaccines on in stock because they have to be kept at certain temperatures. So, but for now, we have vaccine clinics at several of our sites at Gottlieb Memorial, at McNeil, at the main Loyola campus. And like I said, there's some walk-in availability as well, and patients can use the portal, patient portal, to schedule.
Okay.
So.
Great.
Yeah, I'll add to that we've been working closely with the Family Physicians Association and Pediatrics Association, which we did, this whole time. But we do think that people may be more likely to go to their own pediatrician or family doctor, especially in this like 6 months to 4 years age group. So we're really trying to get providers to get comfortable and definitely like offering it, like they're offering every other shot.
Right.
I think we have to get comfortable and just get used to having the conversations. I was talking to a patient this morning about, just the residents who I train talk about just like vaccine fatigue, where they've just talked and talked and talked to families about the COVID shot to the point where they just are like, we're done because everybody's, got a reason why they didn't or wouldn't and I always tell them, I say, you can't give up because sometimes it's not the first time that you hear about, or learn more about the vaccine. It could be the second time or the third time. So every time you're planting a seed that helps and eventually gets watered and watered until they, learn enough and may want to actually go forth with the series, which I encourage. So I think we have to get our game up and get ready to talk more during these, because wellness visits, they're every 2 months, and I'm not sure if the vaccine would, like at what age it would start, but, kiddos are coming in often, in those first few years of life. So we have a ready audience.
That's right. And thank you for that persistence. You're right. We have to keep at it. That's great. Well, I want to thank every single one of you for joining me in this last 30 minutes and for all that important information you shared with us, Dr. Corpix. We'll make sure we post it. This has been recorded, so we'll post it on our website. We'll share it out with everybody. So thanks again. Have a great evening, and hopefully we'll chat again soon. Have a good night.
Good night. Thank you so much for having me.
Yeah, good night. Thank you.
Good night.
Bye-bye.